Thank you, Mickey. Well, it is time to ask the doctor, and today we are talking about something a lot of people are talking about this month. October is Breast Cancer Awareness Month, and while we see the pink ribbons or the different events taking place in our communities, it's important to raise awareness. Certainly, though, important to be able to spot the disease before it's too late. Dr. Benjamin Rauh is an OBGYN at Grandview Medical Center, and he joins us this morning to talk about that. Good morning.
Good morning. Thanks for having me.
And good to see you. So you certainly treat a lot of women with breast cancer. And so today we kind of want to talk about maybe some of the more obvious things that a lot of people know, but some things that women may not be aware of. And one of those things is getting the mammogram. And there's a 3D mammogram now that's not standard across the board, I understand, but you say it's probably the best one?
Well, it's getting better. You know, as of right now, the recommendation is that you get a mammogram per the American College of Obstetricians and Gynecologists. You get one every year. And you start that between age 40 and 49, depending on kind of, you know, your individual risks. If you have a high risk of breast cancer, they obviously start that, you know, a little bit sooner.
That would be family history?
Yes, ma'am. They may look at, you know, family history. They may look at, you know, other things, other cancers that you have in your family. That may be another thing too. But the mammograms are kind of the backbone of our screening. Tomosynthesis is something that's come out in the last few years, and it is showing in some studies that they may have some increased efficacy in finding breast cancer.
That's the 3D?
Yes, ma'am.
Okay. But not everybody has that, right?
Not everybody has that, but I have a feeling, you know, mammogram started back in the early 1900s was the first time that was ever really talked about in literature. It didn't really become mainstream until I think it was the 1970s, somewhere in there. So it took...
That seems crazy, doesn't it, now looking back?
It took a lot of years for that to become mainstream. So hopefully this is not the same lag time, but it should become, you know, something that's more used and more...
And you said that and a lot of women can relate to this, it's more used right now if you have dense breasts, so because it can kind of camouflage and you don't see what on a regular mammogram. Is that what's making the difference for a lot of women in that situation?
Yeah, so a mammogram is just a flat x-ray. It's just like getting a chest x-ray or getting an x-ray of your belly, whereas tomosynthesis is actually something that creates a 3D reconstruction of your breast. So you can look and find out exactly where this is and get a better idea of what you're looking at. It helps the radiologist who reads all these mammograms to actually make a better call in terms of what we need to be doing from the initial screening.
All right, in the few seconds we have left, what do you feel like any woman watching, the most important thing is getting checked, right?
Yes, ma'am. Yeah, so like I said earlier, women ages 40 and up, talk to your doctor about your mammograms, talk to your doctor about breast cancer screening, and get checked.
A lot of the problem, though, we know is insurance, because if a woman doesn't have insurance, she may put off getting that. As we wrap up, what's the danger of putting off those mammograms?
You know, we do screening tests because we want to catch cancer early. You know, heaven forbid, you know, you don't have money, and I don't want to, you know, put that on anybody, but breast cancer screening is something that can save lives.
All right, Dr. Benjamin Rauh, it certainly is important, and we know you're saving women's lives all the time. We appreciate what you do.
Thank you.